Distinguished guests, ladies and gentlemen, let me start by thanking General Dean, Chairman and CEO of CATCA, for the invitation to address you. I very much regret that I cannot be present with you today, and I wish you all success. Ladies and gentlemen, UNODC's approach to drug use is simple. Drug use and drug dependence are health disorders rooted in personal and environmental vulnerabilities in families, schools, and communities. As such, they require an integrated, comprehensive set of responses that treat drug users with dignity and with respect of their human rights. Such an approach requires the mobilization of a broad range of constituencies to work in partnership. It recognizes three crucial elements. The causes of substance use problems are interrelated with other social and public health problems. Evidence-based measures are ineffective if delivered in a piecemeal or isolated manner. They need to be delivered with a concerted and comprehensive process if they are to make an impact. Effective responses to drug use problems require action that is supported at the local, state, and federal levels. A decade ago, UNODC and WHO embarked on a jointly implemented project entitled the Global Initiative on Primary Prevention of Substance Abuse. The project strategy was to support local partners in Southeast Asia, Eastern Europe, and in Africa to mobilize their communities through the provision of technical advice, contacts, funding in selected cases, and the development and dissemination of good practices. A rough estimate of number of people reached by the activities of our local partners is around 33,000 young persons and 8,000 adults. The project was a welcome example of how, while working at the community level, we must think how partnership and political commitment can be developed at the global level. The 2009 Political Declaration on International Cooperation to Counter the World Drug Problem comes in direct support of this global approach. It advocates mainstreaming community involvement and participation as a main part of the response. Moreover, in the proposed action plan of the Political Declaration, all stakeholders at the community level, including the target population, their families, community members, employees, and local organizations, are involved in drug demand reduction measures. As you can see, the establishment of multi-sector anti-drug coalitions is a community response advocated for on a global scale. Such an approach has successfully been implemented in coordination with CATCA since 1980s. CATCA has gradually evolved to become the leading national organization in the United States addressing substance prevention through empowering community-based coalitions and representing their interests. We at UNODC believe that the work done by CATCA is crucial to help communities to build structures that deliver and support substance use prevention programs and initiatives. Your commendable work in forming coalitions helps build competencies to prevent drug use, but it also makes communities safer and healthier. Through these activities, people can connect, discuss, and assume responsibility for their communities and neighborhoods. By providing such training and by representing the voice of over 5,800 community coalitions, CATCA has helped to provide evidence-based programs to prevent substance use. The empowerment of communities is key to prevention. Service providers, schools, and organizations cannot prevent substance use on their own. Community anti-drug coalitions are therefore a great example of how resources and ideas can be combined to have a wider impact. Ladies and gentlemen, I commend you for bringing together so many people interested in community anti-drug coalitions and substance use prevention. The more that people and communities are involved, the more effective our efforts to prevent substance use will be. I look forward to UNODC and CATCA cooperation in the future. I thank you very much.